ask that we begin recording. Thank you. Secondly, I'd also like to note that Zoom does have closed caption services available. If you would like to take advantage of closed captioning, we have turned it on our end, and what you need to do is click the caption option that should be at the bottom of your screen there. If you don't see it, hit the three dots for more, and you should see something there. Click that button, and the captions should appear. Okay, so now a formal welcome and introductions to today's presentation. My name is Eric Fulton. I'm the National Program Manager for Customer Outreach and Communication based out of GSA's headquarters in Washington, D.C., and I will be your host for today's session. Today, we are talking about GSA's proactive and comprehensive approach to water quality management in GSA facilities. We have some great presenters today, including some members of our own Office of Facilities Management, as well as colleagues from the Centers for Disease Control and Prevention. So I want to take a quick moment just to introduce the folks that we'll be hearing from today. First, we'll hear from Courtney Springer. Courtney is the Assistant Commissioner of our Office of Facilities Management, and in that role, Courtney has oversight of over 8,600 federally owned and leased facilities in the GSA portfolio. Also with us is our National Industrial Hygiene and Safety Program Manager, Brad Short. Brad's an accomplished professional with extensive experience in the environmental health and safety field. He spearheads strategic initiatives and coordinates nationwide programs aimed at enhancing standards and and providing EHS best practices across the program area. We will also hear from Courtney Hatchell today. She is the Chief of Staff for the Office of Facilities Management, and she is going to review some of the online resources that we have available for you and your colleagues to learn more about water quality management. Also, as I mentioned, we have a couple subject matter experts with us today from the CDC. We will hear from Captain Troy Ritter. Captain Ritter is a commissioned officer in the U.S. Public Health Service, and he has served as water quality subject matter expert with CDC's National Center for Environmental Health since 2015. Much of the time he spends consulting with water-related disease outbreaks, providing water quality technical assistance for state, local, and tribal authorities, and helping to respond to emergencies and disasters. Also with us is Chris Edens. Chris is an epidemiologist, and he is the lead of the Legionella and atypical pathogens team, working on all things Legionnaire's disease. That includes surveillance, outbreak investigations, developing prevention guidelines, and conducting research with to have a better understanding of all things associated with Legionella in the built environment. So I want to welcome all of our speakers today. Before I turn things over to them, though, I do want to just go over a couple of quick housekeeping notes. You may have noticed that we have muted your audio, our participants, and that is just to preserve the sound quality for our presenters today. However, we do expect, encourage, and ask you to submit your questions as we go through the presentation today. We solicited some questions beforehand during the registration process. Thank you to those who submitted questions in advance. We have subject matter experts on camera and behind the scenes who can take your questions, and we will be answering some during the course of the presentation today. However, it's important to note that in order to do so, please use the Q&A pod. There's a Q&A pod at the bottom of your screen, and that will allow you to submit your questions for our subject matters to review. And like I said, we will pull some out and answer them on the spot today. But all of the questions that we receive, whether we get to them or not, we will pull them out at the end of the session and answer them into a formal FAQ document. We will make that available to you after this session, as well as post it on those two websites I mentioned earlier, www.gsa.gov/CES and www.gov/waterquality. But it's important to note, please put those in the Q&A pod. That's where we export the questions from. And the reason I bring that up, there's a similar pod, the chat pod. That is where if you have technical problems or need assistance in hearing, or something's wrong with the slides or the visuals on your end, you can put a question relevant to the technical aspects of the presentation in the chat pod. We have some Client Enrichment Series members standing by ready to assist you, but we're unable to take subject matter water quality questions in the chat pod. So please put those in the Q&A pod so we have them all in one place. All right, with the preamble out of the way, once again, I want to thank everybody for attending today, and I am going to turn the presentation on over to our first presenter, Courtney Springer.
Thank you, Eric. Thank you again for attending our client enrichment series today on water quality management. I'm Courtney Springer. I'm the Assistant Commissioner for Facilities. Before we get started, I want to thank our friends from CDC. They did not have to join us today, but I'm very appreciative that they came and have a very important part of this presentation for us today. Also, before I start, I want to let you know that water quality management isn't something we should just do in our commercial buildings. It isn't something that stops at a federal facility or a leased facility. It's something that we have to take into consideration in all of our places, including our own homes. So I would ask that you guys pay very close attention to this presentation today for two reasons. One, you can implement this same information at your house. So I've used this example several times before. I had to do some tile work in one of my personal bathrooms at our house. It took me 9 months to complete the project. Besides getting a lot of heat for how long it took me to complete the project, once I turned that water on, it's the first time that water had been on in that line for over 9 months. Knowing what I know now about water quality management, I took some additional steps to flush that water, make sure I had good water going through, and applied disinfectant to the shower head. Another example at home, my mom uses a humidifier at her house. She came down with some health conditions and some pneumonia. The first thing I did was looked at the humidifier in the house to test it. So these are things that you can use both in your understanding of our space at GSA, but also these are things that you can use at home. The other reason I'd ask that you pay close attention is GSA needs your help and support. What we're doing to take proactive steps to water quality management and what we've done in the change of our new policy is a very positive thing. But not everybody considers testing positive. We need to make sure that we're doing the best we can to prepare you to share the message about the positive steps we're taking for water quality management. And that doesn't mean that we won't find things along the way. Part of our approach is to understand the water distribution systems in our buildings and understand how we need to manage them different long term. That's going to be part of the process. But what we're doing is something that's not necessarily required by any law. It's a proactive step to manage water quality in our facilities long term. So some things we're going to go through today. We're going to talk about our partnership that we had with agencies and what that means to our policy and how we drafted our policy based on feedback. We're going to talk about our approach to water quality management. We're going to have CDC provide a presentation. And then we're going to talk a little bit about our communication strategy. And that communication strategy is currently in the form of a website and a fact sheet. We're developing a lot of additional information as well for communication of our processes and procedures. So first, let's start with who we've gotten feedback from. In a couple slides, you're going to see that in 2016, we first put our approach together for water quality management in GSA. Like many of our policies, we put a sunset on them because we want to go back at some point in the future, identify anything that's changed in the environment and change those policies. So our 2016 water policy was one of those that had a sunset date. It happened to be last fall. So last fall, as that was starting to sunset, we had several instances of detection of Legionella in our drinking supply in 19 of our facilities. And we'll get to that here in just a minute. So here we are as the building owners and managing the leases. We had a water policy that needed to be renewed. We had some instances in our building that were different than we had seen before. So we reached out to a number of different parties. So we first reached out to CDC. CDC has an extensive amount of information on Legionella on their website. We focused on that to understand how that would change our overall water policy. We also reached out to occupational safety and health to get some feedback from them and managing situations as they arise in the facilities. We spoke to several state and local regulators. We talked to the Michigan Department of Health, the Detroit Department of Health, talking and working through situations we had in facilities and their locations. We reached out to the California Department of General Services. So the General Services in California operates 60 owned state buildings. We talked to them about what their approach was to water quality management and their inventory-wide testing. And then at the same time, we spoke to the California Department of Health as well about what that approach looked like and the impact that it had on them. We've also brought in outside experts. So one of those experts is IWC Innovations. That firm specializes in water quality management. We've had them review our scope and paperwork. We also reached out to, through CDC support, state and local epidemiologists to talk about what our approach was. In addition to all that, we also relied on ASHRAE. ASHRAE developed standards on air quality and water quality. They updated their water quality standards in the fall of last year, which all aligned up to when we were developing our revised policy. So we also followed and exceeded the ASHRAE requirements. Next slide. GSA is committed through all these activities to maintaining, extending partnerships, getting feedback from all these different regulators, both on the federal, state, local side. We are continually feeding information back and forth between our agencies. We want to make sure that everybody understands what we're doing as we implement this proactive approach. GSA is focused on setting a positive example in the market for what should be happening on proactive water management. Our new policy, we just attended, we had an employee that attended a training on water quality management. Our new policy that's just several months old was already in that class and being trained upon as a best practice. So we're pushing forward and trying to set standards on water quality management and are being recognized as leaders in that area. We asked today for your assistance in sharing this. We want it to be a positive message as we go forward. We're working to develop a lot of information sheets, fact sheets, the websites. I'm keeping you updated on what we're doing because we want to make sure that this information is getting out and people are comfortable with our procedures and processes, and we're taking feedback all along the way. We've met with many of our major tenant heads and have had discussions and have changed and revised our fact sheets, our websites, and in some instances, our policy based on feedback from our tenant agencies. So now let's move a little bit to our approach for water quality management. As I mentioned, we're doing extensive testing, and we'll get to that here in just a minute. And we're doing extensive water management long-term, all an approach to implement our new guidance. This new guidance is not just focused on one thing. The testing is focused on heavy metals. It's focused on bacterial growth. And our long-term management plans are based off of ASHRAE and good practices to maintain water quality in buildings. Our goal is to proactively identify and manage issues, and for us to understand our inventory and understand what changes need to occur in our operations and/or in the plumbing distribution systems in our facilities. Next slide. I can't understate or overstate enough the importance of flushing. I'm going to show you in a minute some of the projects that we've worked within our facilities. By and far, the most part, flushing has resolved issues that we found in our facilities. It's very common that one flushing instance will not resolve heavy metals or bacterial growth. It's quite common that we have to do several different rounds of flushing. But that, as long with follow-up testing, will get us to a point where we've been able to clear the majority of the buildings that we've worked so far. We recognize the need for this additional flushing early in the pandemic. You'll recall during the pandemic, we had a time where our building populations were lower than expected. Those water distribution systems in those buildings are meant and designed for a specific load on the facility. And as that load was lightened, we noticed the need for flushing. And so we sent out guidance to the regions on completing flushing. We're going to pick up that flushing again as we go into this testing program to make sure that we're getting a good baseline to base our test results on. And we're going to verify what we're doing through that inventory-wide testing. And we'll conduct any additional flushing we need to do and any kind of corrective actions we need to do to get good final results. Next slide. So I mentioned earlier the 2016 policy that we had on drinking water. It was a cornerstone in our water management over the last few years. We looked at environmental changes since that was put in place in 2016 and decided to add some bacterial testing into the program. We did that as we spoke to CDC. CDC has some very good graphics. I think there's a slide here in a little bit that's going to show you the number of cases of Legionnaire's disease that have been tracked over the years. From the year 2000 to 2018, we'll notice a 9-fold increase in the number of cases. That was enough for us to understand the importance of testing for Legionella in our water supply and including that in our new policy. Currently, we are managing 19 facilities where we've tested, found results that have Legionella and have gotten 14 of those cleared. Next slide. This shows the 19 facilities, so that's between owned and leased. We have 15 federally owned instances and 4 that were in leased facilities. Of those, 14 have received the all clear. So the all clear to us is we come in, we identify a concern, we close access to the outlet, we flush that outlet as well as others, we come back, test again, and determine if we were successful or it requires another round. That's the process that we will go through. We will also take a look at our results and determine if we need to change any practices in how we operate and maintain the building or change any water distribution system within the facilities. Currently, of those 19, our first instance was last July. We're down to 5 now that we're currently managing. I'm going to go through real quick before I turn over to Brad what we're going to do. And I want to do this because I want to start at a very high level and then I want to have Brad work further on down into the details. So at a very high level, look at 3 buckets of activities that we're doing on 2 different sets of buildings, owned and leased. So first, let's start with testing. Testing on our own facilities. So we have about 1,600 facilities that we're looking at. We are going to do baseline testing on water for all buildings that are over 1,000 square feet and have a potable drinking outlet. So on the own side, that's 1,600 buildings that we'll be doing the testing on. The testing is a representative sample of the building. On the own side, we'll be looking at where the water comes into the facility and the furthest distance in the water distribution system, and we'll be looking at a number of different locations in between. On the leased side, we have about 6,000 buildings that we'll be looking at. On the leased side, we're looking at water testing in spaces that we occupy and spaces that are accessible in common corridors. So that is the testing approach that we're taking. Now, when we go back to the federal side, long-term on the federal side, We've decided to align with ASHRAE standards, and we have what's called focused buildings. So you'll hear focused buildings mentioned several times throughout this presentation. A focused building is a building that's over 50,000 square feet with one or more potable booster pumps and over 6 stories tall. If it meets those criteria, we will put in a longer-term water management plan. So Brad's going to show you on a slide here in just a minute what that looks like, but that equates to about 79% of our square footage are considered focus buildings on the federal side. They will have a long-term water management plan and sampling plan. And now I'm going to turn it over to Brad to get into the details of what that'll look like.
Thank you, Courtney, and good afternoon, everyone. It's truly uplifting to see such a great turnout on today's call. Almost 700 people. That's just amazing, more than we could have anticipated. My name is Brad Short, and I have the privilege of serving as the National Industrial Hygiene and Safety Programs Manager in the Office of Facilities Management here within PBS. I'm thrilled to share with you several of the exciting initiatives under the GSA National Water Management Strategies, several that Courtney just covered a few minutes ago, but a little bit more into the depths for everyone's interest. So let's first dive into the PBS guidance to restore or maintain water quality, which again is tailored for facilities over 50,000 square feet with one or more booster pumps or over 6 stories in height. And this aligns with the inclusion requirements of the new ASHRAE 514 standard, which for reference, it's risk management for building water systems, physical, chemical, and microbiological hazards. Our guidance empowers our O&M contractors to craft water sampling and flushing plans, and they prioritize key aspects such as a workplace hazard assessment, specific details regarding the water source, adherence to temperature thresholds, clarification on the disinfectant chemicals that are used, and precise zoning determinations for the facility. The O&M contractors will conduct monthly temperature and disinfectant residual checks, ensuring timely flushing is achieved when needed. The guidance also emphasizes weekly flushing for designated focus areas, such as health units, childcare centers, and showers, coupled with monthly aerator maintenance. These measures are thoughtfully chosen based on the population they serve and their operational characteristics. Moreover, our plan sets forth specific requirements for building equipment, including continuous operations of hot water recirculation pumps, maintenance of circling hot water to designated temperature ranges, and appropriate settings for hot water storage tanks and point-of-use water heaters. I'm proud to note that with the facilities implementing this guidance, along with those that have already aligned with ASHRAE 188 or 514 standards, we cover 350 buildings and 180 million gross square feet, representing approximately 79% of our owned inventory. Furthermore, regardless of the size of the building, GSA will mandate weekly flushing and monthly aerator maintenance of those designated focus areas. Again, those childcare centers, those healthcare units, and those building and tenant common showers. And this ensures consistent water quality standards across all of our facilities. All right, folks, let's dive into the next big ticket item, our journey to conduct water testing in both owned and leased facilities. This is no small feat. We're talking about approximately 1,400 owned facilities and 6,000 leased spaces. Our objective is clear: to proactively identify any potential issues and refine our water management practices to address potential conditions that might foster the growth of bacteria or the release of metals. It's important to note that routine testing is a proactive measure aimed at ensuring the effectiveness of our water management practices. It's not indicative of an existing risk. Rather, it allows us to make the necessary operational adjustments, such as optimizing disinfectant levels or hot water delivery temperatures. And by doing so, we uphold our commitment to maintaining a safe and healthy work environment. While there's no mandatory requirement for water testing, we acknowledge the significance of this endeavor. That's precisely why GSA is dedicating considerable resources to this effort. Beyond addressing operational concerns, we aspire to be a positive example and inspire other industries and property owners to embrace similar initiatives. Together, we can champion a culture of proactive health and safety measures across various sectors. In fiscal year 2024, so this fiscal year, we will initiate a comprehensive drinking water quality assessment across all federally owned facilities currently active and exceeding 1,000 square feet with a functioning drinking water system. This entails testing a minimum of 10% of water outlets that are primarily designed for human consumption. So you can think of like your drinking fountains, your bottle fillers, your kitchenette faucets, things of that sort. And we will specifically analyze them for the presence of Legionella, lead, copper, and total coliform, including E. coli. Furthermore, we'll take additional Legionella samples from various points within the water distribution system, such as the incoming service line, the hot water storage tanks, expansion tanks, hot water recirculation lines, and both common and private tenant showers. On the lease side, an almost identical process is being implemented in a phased approach, with the first phase having begun earlier this week, actually. And like Courtney mentioned, we'll be focusing on those lease spaces and common spaces that our tenants would have access to. During routine or reactive testing, PBS adheres to the most stringent state or local thresholds for water quality. In instances where such standards are not applicable, we defer to the EPA National Primary Drinking Water Regulations. Specifically for lead, the threshold is set at 15 parts per billion, while for copper, it stands at 13 parts per billion. The presence of total coliform or E. coli are indicators of potential issues. Regarding Legionella, PBS follows the CDC guidance for routine testing of Legionella, which our colleagues in the CDC are going to cover more in great detail later in the presentation. However, this guidance considers various factors such as the concentration, extent of colonization, the type of Legionella bacteria, and changes in concentration over time. While well-controlled systems may require no further action, poorly controlled or uncontrolled systems necessitate additional responses. In the event that test results exceed the applicable EPA state or local thresholds for lead, copper, total coliform, or E. coli, or if Legionella growth is not well controlled, GSA, an agency with delegated O&M authority, or a lesser will undertake the following steps. Promptly notify affected occupants and post relevant signage. If necessary, restrict access to impacted outlets or spaces and provide bottled water. Communicate with the water supplier if deemed necessary. Promptly initiate corrective actions, which may include system flushing, adjusting operational parameters, system disinfection, or even plumbing improvements. Once corrective actions are complete, the water system will then be retested. Affected occupants will be notified of those follow-up test results. And in cases where initial corrective actions may not fully resolve the issue, we remain committed to ensuring water safety. As such, additional corrective actions and testing will be conducted as deemed necessary to address any concerns comprehensively. However, our efforts extend beyond initial testing. Even after follow-up assessments confirm resolution, it's imperative to address long-term water management practices within those facilities. This may involve creating or adjusting current plans to sustain water quality over time. At a national level, we will evaluate all of those test results and consider recommendations for adjustments to the Drinking Water Management Order and Desk Guide. Factors such as percent positivity rate, susceptibility of affected populations, and other pertinent parameters will inform our decision-making process moving forward. Furthermore, like Courtney was mentioning, we remain steadfast in our commitment to broadening partnerships within the federal family and collaborating with outside industry experts. Their insights and feedback are invaluable as the work we do to enhance the drinking water program. Through this collaborative approach, we aim to maintain our leadership position in the industry and uphold the highest standards for drinking water quality. Now that we've delved into the extensive testing effort, let's touch base on a topic that I know is critical to everyone on the call, the schedule. We understand how important it is to you and your agency and your employees to be able to understand the schedule better. For our owned facilities, we've initiated contract modifications and are currently in negotiations through our contracting officers to ensure fair and reasonable prices. We anticipate that testing will commence in some facilities by the beginning of next month and will be completed by the end of the fiscal year. A similar timeline is expected for facilities where agencies have delegated O&M authority. Training for those agencies was successfully completed last week, and the 90-day comment period on the standard operating procedure for delegated facility ends near the close of March. All testing must be concluded by those agencies by the end of the fiscal year. Regarding leased facilities, a similar process is underway. And as I mentioned a few minutes ago, it's being rolled out in several phases, and the first phase already began earlier this week with a small batch of leases. GSA is committed to providing customer agency leadership with a list of all spaces slated for testing and a general timeline here shortly. Testing coordination and communication will be handled at a local level. Additionally, GSA is developing a national testing schedule resource for our valued customers to streamline this process and enhance transparency. All right, with that being said, now let's redirect our attention to another critical aspect of our water management strategy, non-potable systems. While not directly related to the drinking water that we consume in our bodies, they play a significant role in our overall water management approach. We'll be conducting monthly Legionella testing on cooling towers, ornamental fountains, misters, and humidifiers during the operating season. All right, I think that's about it for me today. But before I turn the floor over to the CDC, I'll pass it back to Eric to address some initial questions that have been submitted through the Q&A pod.
All right, thanks, Brad. Thanks, Courtney. Yes, the testing and schedule component did generate a couple of questions that I think it's worth mentioning and reiterating. Brad, you just mentioned this, but can you go over, because someone did ask if our customer agencies are going to get a broad picture, like an overview of all of the facilities that they're in. I know you said things are coordinated at the local level, but we will be giving our customers a nationwide outlook.
Yeah, maybe I'll pass that one actually over to Courtney, if you don't mind.
Sure.
Happy to take that. So we have been working very diligently since this last year when we started to update our policy. And just to give everybody on the line a little bit of understanding, we wanted to first start managing the various projects and buildings that we found areas that exceeded test results first. So we wanted to understand that. Then we wanted to understand how to change our policy. Then we started developing contract modification language to get these into contracts. Then focused on, in a minute, you'll see our fact sheet and website. The very next step we're working towards is making sure that we have a way to tie exactly when these leases are modified and exactly when we are able to get our O&M and janitorial contracts, our O&M contracts modified to include this scope of work. As soon as we get that, we're going to start relaying out to the agency heads which buildings, the timing, so everybody's aware of when those scopes of work are in the hands of the contractors and they're ready to go. Additionally, we're working on communication tools at the local level to make sure that we're advising when a test result can occur and providing information at the local level. I will let you know that there's current practices in place in many of these buildings that already include some type of testing. So any of these buildings that have a cooling tower, there's currently quarterly testing that occurs. As Brad mentioned, we're going to move that up to monthly. But don't be surprised if somebody comes to test water quality outside of this scope, because we do water testing for other purposes in these facilities. So currently, as Brad mentioned, the first round of the lease contract actions have just gone out. It's a small subset that we're starting with to make sure that we are good with scope, good with understanding, get these delivered to the vendors. The pricing we have set is right. But as we start to the next phases on the leased and owned, we'll be getting those lists together and making sure we're communicating that to the agency heads.
Great, thank you. And actually, you mentioned something that someone else just asked a question on here. It's about the frequency of water testing and how often is water tested in GSA buildings? And is there like a relevant standard in commercial buildings?
So,
Yeah, I can take that one, Courtney, if
go
you
ahead,
don't mind.
Brad. You want to do
Yeah,
that?
absolutely. So while there's no mandatory requirement for water testing, we do acknowledge the significance of this endeavor. And that's why we've dedicated all these resources to this testing effort. And beyond addressing those operational concerns, like I mentioned in the presentation, we hope this inspires other property owners to take similar efforts and be able to verify the water quality of their facilities as well.
All right, great. Let's
Eric,
see. Go ahead.
Eric, there's one thing I wanted to add to what Brad mentioned. The other thing that I think that's really important is we're going to be testing a large number of facilities, and from that, we're going to get a lot of data. So as Brad mentioned in his presentation, we're dedicated to take that data, understand it, compare that to the ASHRAE standards of what is required for a focus building, and understand what future requirements may be there based off of this baseline testing. So we're going to learn a lot from this baseline testing and look forward to incorporating that into any further policy updates we do at GSA.
All right, thanks. Let's go with one more question and we can move on, and it is about testing. Who actually will be conducting the testing and how will it be completed?
Yeah, absolutely. This is a really important question. And, I come from an environmental engineering and an IH background. So this is where I get excited, right? And one of the most important things that needs to happen when you're doing any sort of testing is to use a qualified professional. You can't just have anyone that's untrained going in and taking a water sample, or you end up kind of in a pretty bad spot where you have false negatives, false positives, and just poor sampling technique. So outlined in the scope of work for both the owned facilities and the leased facilities, it defines what a qualified contractor would be. So for our owned facilities, the contract is going to our O&M contractors, and then they are subcontracting it out to a qualified professional. For leased locations, it goes to the lessor, and they're responsible for subcontracting that out to a qualified professional. And we define that as somebody that has either an ASSE 1280 Legionella certification or a certified industrial hygienist, or a health and safety individual that's being supervised by a CIH or an ASSE 1280 certified individuals. And these experts must have a minimum of 2 years of on-site experience conducting potable water sampling, including microbiological sampling methods for Legionella. Additionally, it's also important that you're using qualified laboratories as well. So in the scope of work, it specifies the requirements for the laboratories that's going to be analyzing the samples. And then it also has a requirement for a full report to be developed and submitted to GSA once those laboratory results come back. So through all that, that's basically kind of who's doing the testing, how it's going to be relayed back to GSA, and then ultimately to the customers.
All right, thank you. That was a great comprehensive answer. All right, let's hear from our colleagues at the CDC. Like I said, we are fortunate to have them with us today. We are going to transition over, and first I believe we're going to hear from Dr. Troy Ritter.
All right, give me just a minute here to get my equipment up and working.
Eric?
This is not my presentation.
Yes.
Yeah, I think I'm going first.
I think Chris is going first, yeah.
Oh, I apologize. I have it swapped in my run of show. That is on me. So we're going to put Dr. Ritter on the back burner, and Chris Edens is going to be speaking first. That's my apologies.
No problem at all. So once again, I'm Chris Edens. I'm the lead of the Legionella and atypical pathogens team in the respiratory diseases branch here at CDC. I'm going to talk a little bit today around Legionnaire's disease in the United States, including what it is, what causes it, how people actually become infected, who might be at greater risk of becoming infected, and as was previously alluded to, a little bit about what cases look like in the United States, especially over the last couple of years. Next slide. So Legionnaire's disease is caused by a bacterial infection, and the bacteria that causes it is called Legionella. So it's a gram-negative bacteria. It's primarily found in freshwater sources such as lakes and streams. While more than 60 species have been identified, and a number of them can cause human illness, one, Legionella pneumophila, causes more than 90% of reported cases in the United States. Next slide. So Legionnaire's disease itself was famously identified back in 1976, associated with a large outbreak of respiratory illness at the American Legion Convention at the Bellevue Stratford Hotel in Philadelphia, Pennsylvania. That initial event is actually how the disease got its name. That's why it's called Legionnaire's disease. Furthermore, that's actually why the bacteria is called Legionella pneumophila. Legionella for the American Legion Convention, and pneumophila because most of the people who got sick at that convention had pneumonia. So once again, it's caused by an infection with Legionella bacteria. You typically see an acute onset of lower respiratory illness between 2 and 14 days after exposure. So the incubation period can be relatively short, or it can be relatively long. Typically, in the data that we see, between 4 to 6 days following exposure is when symptoms typically present. Legionnaire's disease itself is quite a severe illness. It's characterized by severe pneumonia and virtually always requires hospitalization in the data reported to CDC. It's fatal in approximately 10% of cases, though that does really depend on comorbidities of people that have been infected. And for folks that may have acquired their illness during a stay at a hospital, the disease is particularly deadly, with evidence indicating up to 25% fatality if the disease is acquired as part of a hospitalization or inpatient stay. I do want to note that despite the severity of this illness, Legionnaire's disease is treatable. It's treatable by a number of common antibiotics that are available in most healthcare facilities, though not every antibiotic successfully treats Legionella bacteria, which is one of the reasons why it's so important to seek care and mention to your provider if you believe you've had an exposure to Legionella, so you can receive appropriate testing and prompt treatment. There are some other conditions caused by Legionella bacteria. One, Pontiac fever, is a very mild respiratory illness. We typically refer to it as a flu-like illness. It's fully self-resolving, does not require treatment, and virtually never requires hospitalization. And the second, which is much more rare, is known as extrapulmonary legionellosis. So this is when Legionella bacteria infects some other part of the body besides the lungs, which can include wound infections or infections of the heart. This is exceedingly rare, though we do see it sometimes, especially in edge cases. Next slide. So in the next 2 slides, I'll talk a little bit about how someone actually gets Legionnaire's disease. So I mentioned earlier, Legionella is a ubiquitous pathogen. It's found in many freshwater sources, though the level of bacteria present in those sources is typically not high enough to cause infections in people. You don't traditionally see Legionella infections from swimming in a lake or swimming in a river or something like that, because the amount of bacteria in those systems is just so low. When Legionella bacteria gets into a complex water system, such as a building, a big office building, a hospital, a cruise ship, basically any kind of building with really complex water systems with interconnected pipes, with water heaters, water storage, if those systems are not being properly maintained, if the water in those systems does not have an adequate amount of disinfectants such as chlorine, if the water in those systems is being maintained at an inappropriate temperature, which for Legionella is between about 77 and 115 or so degrees Fahrenheit, Legionella can rapidly grow and multiply. And that is where the issue occurs. Next slide. So it's not enough just to have Legionella in a water system. You don't get infected with Legionella person to person. It's not transmittable that way. You get Legionella and Legionella infection or acquire Legionnaire's disease through inhaling misted water. So to get from the pipes to your mouth, some sort of aerosolizing event has to occur. Typically, that occurs through a number of common devices, such as showers, hot tubs, or devices such as cooling towers, which is one of the reasons that GSA and other entities spend so much time ensuring that Legionella can't grow in cooling towers and other types of devices that may do a really good job aerosolizing water and can be challenging to maintain in an appropriate manner due to their standard operating procedures. Once someone inhales Legionella into their lungs, that is traditionally how you become infected, though I will note you can become infected through aspiration. So this is colloquially referred to as, drinking water down the wrong pipe. There are some people whose comorbidities might make them more susceptible to aspiration, but that is not the traditional route of exposure. The traditional route of exposure is inhalation of aerosolized water that contains Legionella bacteria. Next slide. I alluded to earlier that there are some people who might have risk factors that could make them more prone to acquire Legionnaire's disease following exposure to Legionella bacteria. You'll see on this list some pretty common risk factors for a lot of different respiratory diseases. It is not unique for Legionella. These are risk factors for a number of diseases like that, such as being over the age of 50, a current or former smoker, having some sort of chronic lung condition such as COPD, an immune compromising disorder due to treatment for cancer or other types of immune modulating conditions, some sort of malignancy, or a number of different underlying illnesses that could make your body more susceptible to infection. Next slide. There are a number of different tests that are specific for Legionnaire's disease, and it is particularly important to make sure that your provider, if you have appropriate symptoms, knows that you may have potentially been exposed, because while there is a number of common tests, they are not always performed, and Legionella symptoms and X-rays and CT scans that might indicate the presence of pneumonia don't look any different for Legionnaire's disease than for many other severe respiratory illnesses. So some of the tests that you might encounter or that your doctor might order include the urinary antigen test. So this is by far the most common type of test. It is non-invasive. It uses urine and detects Legionella pneumophilus serogroup 1, which is by far the most common cause of disease in the United States. Other two tests that we recommend but might be less frequently used are nucleic acid amplification tests, also known as a PCR test. So this is done on a sputum or phlegm that you might cough up during your illness or as part of this test. Similarly, that phlegm or sputum can be cultured and specific bacteria, Legionella bacteria, can be isolated from that sputum. Next slide. As was alluded to before, Legionnaire's disease is on the rise in the United States. So since about 2000 to 2005, there has been a steady increase in cases in the US. The cause of this increase is likely multifactorial. It could mean everything from the age of buildings in the United States growing older, which makes them more difficult to maintain, the age of persons in the United States growing older, which means more people might have comorbidities that could put them at risk for infection. Similarly, there are a number of weather patterns that have been shown to increase the risk of Legionnaire's disease, including warmer weather and wetter, rainier weather. I will note that there was a relatively significant decrease in cases reported in 2020. We believe this is almost certainly due to non-pharmaceutical interventions as part of the COVID-19 pandemic or possible travel restrictions that were implemented as part of that response. Some data that aren't finalized yet, but for 2021 and 2022, we have seen an increase in cases much closer to the baseline we were seeing in 2018, 2019, before the COVID-19 pandemic. I also want to note to end that Legionnaire's disease is often underdiagnosed. As I mentioned before, it has relatively nonspecific symptoms, and a number of antibiotics can treat it without a provider even knowing what might have caused the underlying illness. Some studies have indicated that maybe half of Legionnaire's disease cases that exist are actually never successfully identified by providers or by public health. So just to let everybody know that while these numbers have been increasing over time, it's possible the true amount of cases of disease out there are even higher. I think that's it for me. So happy to answer a few questions before we go to the next slide deck.
Oh, thank you, Chris. Appreciate that. That's a great overview of the difference between Legionella itself and Legionnaire's disease. A couple of questions that came in that I think you would be great to answer. This first one, the person says some studies have shown that Legionella is present in 50% of facilities. So they're asking, is it that common to find Legionella in buildings drinking water? And then they add, should I be concerned?
Yeah, so, I mentioned before that Legionella is ubiquitous in the environment. It is not unusual to find Legionella in the environment. It's actually expected. And while water treatment providers typically take a number of steps to prevent pathogens from entering the municipal water system, such as the addition of disinfectant like chlorine, it is not uncommon for Legionella to enter a building through the municipal system, especially at low levels. And that is why water management is so important. If a building water system is not being properly maintained and a small amount of Legionella comes in from the premise plumbing system, it can grow rapidly. And so as a result, if you have a lot of buildings whose water has not been maintained over time and you test them, it is not that unusual to find Legionella in those systems. What you're really trying to do is put in place appropriate measures to prevent any Legionella from growing, spreading, and becoming uncontrolled. So the second part of your question about concern from building occupants, it really depends on a number of different risk factors. So there's no known safe level of Legionella. But that being said, finding Legionella in a building does not necessarily mean people are going to become infected. I mentioned that to become exposed, you have to be exposed to aerosolized water. So, making sure that your aerosolized water systems are being properly maintained is increasingly important in these situations. And additionally, there are people, as I mentioned before, that are at higher risk. And if you believe you're at higher risk, it's probably worth talking to your provider about what steps could potentially be taken to ensure that if Legionella is present, you're properly protected from potentially being exposed.
Good tips. And actually, we got a question kind of just on that. So are there any other general suggestions that you have if you are a worker who is in a building where Legionella is detected to avoid becoming sick? A general I don't want to say a person who's at not necessarily high risk that would consult a doctor, but just generally speaking?
Yeah, I mean, the primary steps you can take is preventing exposure. I mentioned having Legionella in the pipes does not immediately mean you're at risk of exposure. So avoiding potential aerosolizing devices such as showers primarily, but also, potentially sinks or using bottled water instead of drinking from a water fountain or using a bottled water filter, bottled water filler are options. Additionally, there's steps that building owner and operators can take. And that involves a lot of the factors that were mentioned by Brad and others earlier on the call, that if Legionella is found, taking appropriate remediative steps to ensure that Legionella doesn't continue to grow, that those numbers can be knocked down and can be ensured that the system is in a well-controlled state.
Sorry about that. Coming off mute. One more question. Is there, to your knowledge, a required cadence or schedule for testing for Legionella in buildings?
Not generally. As I think was mentioned by some others on the call, there is no federal standard for testing for Legionella, specifically in office buildings. There may very well be some state or local rules or requirements. So it's always important for building owner operators to abide by any state or local rules or requirements. But as far as cadence, it really depends on the performance of a water management program. If it's performing adequately, maybe less frequent validation and verification is warranted. If it's not, if you're detecting a lot of results that are concerning, maybe something more frequent is in the cards. And additionally, it depends on what you find. If you're finding a lot of Legionella, then maybe a little bit more frequent testing is appropriate. And if you're not, maybe that cadence can be spread out. I'll note as well that a lot of what we're talking about today is routine testing. So testing when there are no cases of disease associated with a particular building. If there is a case of disease, the situation might change. There might be additional recommendations from public health or additional recommendations for remediation or testing in response to something like that. But for routine testing, it really is a building specific situation.
Excellent. So having a specific water quality management plan per building is probably a very good idea. Chris, I'll let you off the hook on that. We have some other questions. Maybe we can follow up with you at the end of the presentation. But I teased earlier your colleague, so now I would like to thank you and bring up your CDC colleague, Dr. Troy Ritter.
Yeah, good afternoon, everyone. And thanks for the nice introduction in the bio earlier. You know, it seems like what we've heard today, Legionella comes with some health concerns. It can be risky, but what can be done to implement control strategies? Well, water management is one of those that can be done on a building level. So in this presentation, I'm just going to briefly touch on water management practices and programs for Legionella control and prevention. And I'll also just briefly touch on lead and copper. If we could advance that slide, please. All right, well, understanding the root cause of Legionnaire's disease outbreaks is critical to the development of prevention practices for Legionella. CDC conducts, when invited, outbreak investigations in the field. And I just returned from one of those last week. The environmental data from these types of investigations is often rich in environmental root cause information. Now, we collect this information and have analyzed it. And one take-home message from that is that our analysis shows that about 9 out of 10 outbreaks were caused by problems that were preventable through more effective water management. Next slide, please. So as we look at those root causes and analyze the data, 4 themes emerge from the data. One, we title a process failure. And a process failure, this is a specific process that is missing or inadequate for prevention of Legionella control and spread. This might be, for example, the absence of a flushing program when one is needed. Or just not adequate to remove enough water from the building. A human error, of course, this is when a specific person just didn't act as expected. An example of this, going back to that flushing program, there could be a flushing program and it could be adequate if implemented correctly, but maybe this person just didn't do it. Maybe they cut the runtime for the faucets in half. Or maybe they just skip some areas. Equipment failure. This is when a specific piece of equipment didn't operate as expected, or maybe it was just inadequate to begin with to prevent growth. For example, maybe this building had a supplemental disinfection system to limit growth because they weren't getting adequate disinfectant from the municipality, but they had a pump failure. And unmanaged external changes. This is when an adjustment isn't made to account for events that occur outside the building water system. And that's really the key here, is these are things that happen outside the building. For example, this could be when a major water main breaks and causes problems within the building, such as backflow to disrupt the biofilm. You know, there are measures that can account for that, and maybe in this case it wasn't done. So those are the 4 main categories that cause problems and can be addressed. Next slide, please. This slide just shows the steps of developing and running a water management program. Water management programs analyze the entire premise plumbing building water system to assess the risk. Once areas at risk of Legionella growth are identified, appropriate control measures are applied, monitored, and verified. So it's a circular process that doesn't really ever end. Protocols for ways to intervene when control limits are not met are established. And once these actions are up and running, all activities are documented and the program is continuously reviewed. Next slide, please. All right, now let's talk about building environmental assessments. Here's an example of a premise plumbing schematic. And when I say schematic, I want to mention there's sort of two types of drawings that you want to look at. One is a drawing that represents what might be known about the facility, but it's not an exact replication of the piping system. Also, sometimes those are called blueprints. And then there's as-built that reflect more closely what the pipes look like. But in this schematic, you can see on the right side there in that box, you have all of the certain risk factors that can cause Legionella concerns: temperature, stagnation, lack of disinfection, and then conditions for bacteria spread, special considerations for healthcare or others, and external hazards. But conducting environmental assessments is important for several reasons. You can identify potential risk factors, can better understand what types of interventions are needed, understand whether sampling needs to be conducted, and if so, the environmental assessment can help to inform your sampling plan and procedures. Next slide, please. All right, so water management program requirements and standards. If water management is at the center or at the heart of Legionnaire's prevention, what requirements or policies are available or in place? Well, one, you've got the American Society of Heating, Refrigerating, and Air Conditioning Engineers, ASHRAE. I saw that has been mentioned several times already. Released Standard 188 in 2015, was revised in 2018. This is the only standard for Legionella risk management in building water systems on the federal level. ASHRAE 1220, of course, released in 2020, complements Standard 188 by providing guidance on how to develop the necessary elements of a water management program. So it just fills in some gaps and adds detail and instructions. And then there's a couple of facility-based or organizational-based standards out there that you might want to know about. The Veterans Health Administration has their Directive 1061 that, of course, is applicable to Veterans Health Administration buildings. And then the Centers for Medicaid and Medicare Services released their own specific standard in 2017. Next slide, please. All right, well, at the foundation of water management is ASHRAE Standard 188. Developing and maintaining water management program is a multi-step process that requires continuous review. The CDC toolkit, pictured there on the right, you can see on the screen, is designed to help people understand which buildings and devices need a Legionella water management program, what makes a good program, and then how to develop it. It's really a useful tool. Next slide, please. Here are some additional resources and tools that you might want to know about. We also have a toolkit that helps to evaluate risks and hazards and implement control measures for Legionella that align with ASHRAE guideline 1220. And then sampling procedure and potential sampling sites protocol for Legionella. That's a valuable tool. We have 6 environmental investigation videos. I think this is one of the more useful tools that we have. And in fact, I watch these routinely, even though I've been doing this for a couple of decades. You know, when I was out in the field, a week and a half ago, you know, sometimes we go a couple months without doing this in the field, a few months. And I want to make sure that I'm getting every detail exactly right. So I'll pull out one of these videos and watch it myself. They are pretty useful. Legionella Environmental Assessment Form, also called the LEAF. This is just a form or a guide that you can use to conduct a Legionella environmental assessment. It's also something that I use frequently. And a document preventing Legionnaire's disease, a training on Legionella water management programs. Those are all useful tools. Next slide, please. All right, so I'm just barely going to touch on copper. You know, here are a list of the health concerns. I maybe don't need to read through all of these, but of course, copper is a metal. It's found throughout the environment, like Legionella. It's can be ubiquitous. It's in the air, it's in the soil, it's in the water. It's an essential part of our diets in small amounts, but in too much, it can be harmful. Ingesting high amounts of copper can cause vomiting, nausea, abdominal pain. And let's go on to the next slide, please. I think we're going to talk just for a minute about lead. Yeah, lead, much like copper, lead's a metal found throughout the environment, including air, water, soil, attacks the nervous system, and the main target for lead poisoning in children and adults, but it can also affect every organ of the body. Let's skip through this on to the next slide, because I want to make an important point here. There are things that you can do for this. There are factors that affect both lead and copper in the water, such as the acidity or the alkalinity of the water, the types and amounts of minerals in the water, the amount of lead and copper that the water comes in contact with. Water temperature. Sorry, I'm having a little technical problem in that when a message pops up, I can't see my slide. There we go. The amount of water in the pipes, how long the water stays in the pipes, and the presence of protective scales and coatings. There's one key point, and this is probably the only key point I'll make in terms of lead and copper. Lead and copper water management is a specific craft and practice, and some of those practices might be different than water management for Legionella. So for buildings that have concerns with both Legionella and lead and copper, you really need a good plan and a competent professional to address these multiple concerns simultaneously. This is one of the most difficult challenges that we face. Next slide, please. There's the end for me. I just want to thank everyone, and I believe at the end here we'll take some questions. Thanks.
All right, thank you, Dr. Ritter. Going back to those factors that you shared, and I know you made the point that you need a competent professional and a good plan, but are there any, what's the word I'm looking for here? I mean, are there any best practices or general tips that people can use to minimize their exposure to lead and copper?
Yeah.
In their drinking water, their systems?
Sure. Well, first let me hit on just the main barrier or problem when you have Legionella in the water, and that is temperature. Of course, Legionella, you want to keep the water typically above the danger zone, maybe 113 or above, but that high temperature tends to encourage absorption of lead and copper into the water. So one of the things that I would do, just in terms of lead and copper, maybe the first thing is to eliminate any kind of sources of lead and copper, brass fixtures and solder and any kind of piping. But also you can do things to control temperature specifically, in such as wrapping the pipes and rerouting them out of hot areas, adjusting for pH, and you can also use things such as orthophosphate that will create a scale on the pipes and limit the absorption of lead and copper. That's often done at the water plant level, but there are also things that you can do on the building level itself. Anything else?
You mentioned the tools in the toolkit that you had. Are those all available on the CDC website, or where would we find those?
Yes, you can get those on the CDC website. And I believe somewhere in my presentation, I saw a link to those, but I think that we can hopefully drop one in the box there so everyone can be sure to get that. But I can tell you this, when I want something like that toolkit, if you just Google CDC Legionella Toolkit, it'll pop right up.
Excellent, thank you. And yeah, we'll see if we can get a team member to find that direct link, but I'll also remind all the folks with us that you will get a copy of these slides after the presentation. So if it's embedded in the presentation, you will have it at your fingertips shortly. And I think maybe one of my teammates did just put that into the chat. Thank you, Dr. Ritter. Appreciate that. We'll have you back for some Q&A after this session here in a little bit, but we do have one final piece of our presentation today, talking generally about communication strategy with some information and resources that we have. And I think I segue to Courtney Hatchell for this.
Yep, that's right. Thank you, Eric. Good afternoon and morning to all of you. My name is Courtney Hatchell. I'm the Chief of Staff for GSA's Office of Facilities Management, and I'm going to take you on a little bit of a deep dive into our communication strategy, and in particular, two of the tools that we've already developed and shared. I'm also going to be driving the slides as I speak, so bear with me if that we need to take a couple pauses. So the first one I'm going to dive into is our website, and I'm pulling that up now. Slowly.
While that comes up, this is the website that we mentioned in the beginning. The shortcut URL for that is www.gsa.gov/water-quality.
Yes, thank you, Eric. So as I mentioned, this is our water quality website. You can see this here on my screen. I'm actually going to fast forward or skim through here quickly to get to the other tool, just to talk a little bit about the differences between the two and how we intend to use them. So scrolling down, I'm going to click on our fact sheet, which is right here. And I'll pull up the PDF version of that because it's a little clearer to view. And I'm going to make it a little bigger for everyone. There you go. So this is the fact sheet, which is now showing. The fact sheet is meant to be a point in time tool, and it's going to be for you to reference in regard to the current testing and water quality management effort that we've described here today. So as you can see, we list some highlights of the new guidance. We also give a broad overview of the strategy underway this year and touch on some key points, such as what to expect when testing occurs in your facility, how the unique nature of each concern in each building determine corrective actions, and how our focus remains on actively addressing underlying issues while we ensure safe alternatives for water consumption. In addition, we've, as I mentioned, high-level view of the water quality management strategy. There is also, as I'm scrolling down, there are also some FAQs, which we've compiled and summarized over the last few months. And that's just a quick look at the fact sheet. So now I'm going to circle back to the website. Bear with me. And I'm going to go back to the overview. Okay, so so as I mentioned, now we're back at the website. In contrast to the fact sheet, this website we intend to be more of a living site. It's going to be dedicated to GSA water quality management beyond just our efforts this year. That being said, this first iteration is very focused on the testing effort, and it does go into a little more detail on that than the fact sheet does. So as I'm scrolling down, you can see that we have links that you can click on that are going to walk you through what those different initiatives are going to be in our federally owned facilities. I'll click on that really briefly. So it'll go into a little more detail on what's going to happen in the federally owned facilities. And then also you can click if you sit in a lease space and see what the strategy is going to be there. Again, these are the things that were covered in the previous slides. And then I'll go back to the overview. And I'm going to scroll down to several other resources available on this slide. There's some general resources, resources that we've mentioned before that include some deeper dives provided by our customer agencies into water quality and the substances that we are testing for. I believe that toolkit that we were talking about before is linked here as well. And then one last thing that I want to bring everyone's attention to is at the top of the, oh, where is it? There is a location, there we go, more information. So there is an inbox that we created called waterquality@gsa.gov. This is for you to send questions that you have that may have not been answered by the fact sheet or the website. And we really welcome your feedback, as it will inform updates to the website, as well as our future plans for that FAQ feature that we talked about before. And then lastly, I do want to say that any questions that you have about your specific location, those should be directed to your GSA building manager or lease administration manager. Now I'm going to head back to the slides. And just 1 second to get it to full screen, and I will go back to my communication strategy slide. There we go. And I'm going to just talk about some of our next steps. So next week, we will be providing a customer agency leadership with a list of all the locations that will be tested, along with a general timeline for that testing. As noted, specific information and testing dates will be coordinated and communicated at a local level. And we're also working on a national testing schedule resource for customers to be shared in the coming weeks. Finally, website updates and additional client enrichment series events are forthcoming. So that includes my portion, and I'll turn it back over to Eric for some final Q&A.
All right, thank you very much. And just to build on what you just said there, Courtney, that website, the gsa.gov/water quality website, is a great resource. There are a lot of questions I've seen come in, or that we have heard from customers and from tenants, that are answered on that website. There's a lot of great tips and resources, our plans, and then as Courtney mentioned, a lot of links to a lot of the great CDC resources that are out there as well. So I encourage everybody not just to take a look at that, but to share that within your organization as well, because that will be continually updated. So I do have been collecting some questions as they've been coming in. I'd like to invite all of our speakers to kind of be at the ready here. I'll try to batch them as best I can. The first couple are going to be for my GSA colleagues, and specifically Courtney Springer. And Courtney, just to prep you, it's about leased and delegated facilities. We have had a couple of questions come in about those in particular. And so the first question is, what are the requirements for water management plans for GSA leased offices? I know you touched on this. Can you go maybe a little bit deeper into what the plans are for leased locations?
Yeah, Eric, happy to. So on those 6,000 leases that we have, anything that's over 1,000 square feet and has a potable water outlet's going to be tested. We are working to get those unilateral agreements out to all the lessors. They're going to test, again, the spaces within the occupied space of the agencies, and anything that's in a common area that a tenant could get to. The lessors are required by the lease to provide quality water to the facility. So this first test, GSA is going to be required to pay for, and we will be doing that. Any subsequent test, if anything's found, any change in their plumbing distribution system, any kind of plan that they would need to put in place to manage water, would be at the cost of the lessor. We are working templates to make sure that if any kind of issues indicated in the lease facility, we're following up with that lessor to assure that they make any kind of repairs or do flushing that's required. And then we will be making sure that they also close that out with us. Any test required or any change required after that initial test will be the lessor's responsibility. And our lease managers will be watching that closely to make sure that they identify, rectify any situation and retest.
All right, great. Thank you. I think you actually answered about 17 customer audience questions in that one response. So thank you very much. We also got a couple questions about delegated buildings. And for those who are unaware, GSA owns some buildings, but has delegated the operation and maintenance to customer agencies. And so, Courtney, in those instances, how are delegated buildings being treated, and what is GSA's responsibility versus the customer agency?
Yep, great question. So on those delegated facilities will be treated just like federal facilities. That's what they are. So we've gone through and we've looked at every single one of those delegated facilities. We know if they include baseline testing and if they include, if they're considered a focus building, which means they'll have a longer term water sampling or water flushing plan in place. We have relayed to every single one of those delegated facilities what they need to do, what the scope looks like. We've had conversations with many of them. And last week we ran a series 3 days in a row for our delegated facilities where they could come in and ask questions of our group. I will say I'm very impressed with the delegated facilities. For the most part, they understand exactly what's required. And they're working with their O&M vendors in the space to get pricing just like GSA is, and are working to complete the testing and get the subsequent plans put in place if the building is a focus building.
Great, thank you. I do just want to remind everyone, you can continue to submit questions through the Q&A pod. I've been pulling some out. I will be upfront. We will not be able to get to all of your questions in the remaining time, and many of the questions that are very good that have been coming in will require a little bit of either research or some thoughts, or are about a specific location. So if we don't get to your question, I just want you to know we will get to all questions after this with a formal Q&A document after review by our subject matter experts. And again, we will both share that with all registrants, as well as post that on our CES website, as well as that water quality website that we have been talking about. We have several questions about Legionella and Legionnaires, so I will put my CDC colleagues and Chris on the spot. This question is asking, why is a representative sampling methodology used for routine and follow-up Legionella testing? If initial results indicate Legionella in certain outlets, should every other outlet in the building then be tested?
Yeah, that's a good question. You conduct representative sampling because it's often either not reasonable or not possible due to capacity constraints to test every single water source in a particular building. You can imagine buildings could have from a handful of faucets to tens to 20 to 30 faucets, depending on the size of the building. We've encountered situation in hospitals where the number of potential places to sample could be in the hundreds. And often you just genuinely don't have the capacity or testing capacity or even time to do that many samples. So what is traditionally recommended, especially for routine testing, is what's known as representative sampling. So the idea is you want to collect enough samples from enough different types of fixtures and locations so you can feel confident that your results indicate a reasonably comprehensive picture of water quality in a particular building. There are some standard places that are included, many of which were talked about previously by Brad and his colleagues, which includes points of use such as fountains or showers. It includes samples associated with the larger water systems, such as a water heater or water storage device. It could include specific devices, such as a fountain or a cooling tower or some other type of device like that. Traditionally, the way we think about representative sampling is it is supposed to be representative. So, for example, if you do sampling and 10% of your faucet samples test positive, a reasonable conclusion is that about 10% of the faucets in a particular building might be positive if you were to have sampled every single one of them. So that's kind of the idea. Not only does it allow you to collect a large amount of information from a relatively small number of samples, it can also rapidly pinpoint where a problem might be. If you're collecting representative samples from all different floors of a building and you see an unusual concentration of positivity in one particular wing of the building or one particular area or even one particular type of device like a shower, that can lead you to logical next steps. Maybe that part of the building is underused and has not been flushed as frequently. Maybe there were some recent occupation changes. Maybe that used to be a really full part of the building and one of the lessees has moved floors or something like that, which could potentially have caused a change in water. So that's traditionally why we really lean on representative sampling, because it can give us a lot of information and can allow for potential more targeted follow-up sampling. If a particular area seems to be an issue in a building, more testing can be concentrated at the problem spot rather than tests that might just tell you something you already know from the routine, more representative sampling event.
All right, thank you. We had a similar question that you may have just addressed this, but I'll ask it anyway because I think it's good to know. And maybe Brad, you want to be talking about the kind of GSA perspective on this as well. If Legionella is detected, and you just talked about sort of the representative sampling, so if it is detected, does that automatically trigger some sort of a water restriction? Or does that automatically mean that we should be closing all or parts of a facility? What sort of mitigation might not be the right word, but what is the response when there is that detection?
Sure, I can talk at a high level and then happy to throw it over to Brad for some more GSA specific language. You know, at a high level, the response is truly building specific. It seems not super satisfying to phrase it that way, but it really depends on the type of building, how water flows through that building, and what you find. If you're finding a single positive in a really big building with really solid water quality and good representative sampling that has shown over time a well-controlled state of Legionella growth in a building, the response could be totally different from a situation where you're finding a lot of Legionella at high levels in multiple locations, potentially multiple different species. So the response is really specific to the building. It's specific to what you actually identify. You know, restricting certain types of devices can be a standard response. You know, I mentioned in my presentation and others alluded to as well, there are certain devices that are just known to be higher risk. And something like a shower, for example, is known to be higher risk than something like a toilet or a sink, which is thought to be a much lower risk type of point of use device. You know, the building level factors really matter here. So what that water looks like in the building, what your environmental assessment looks like, how that water is being controlled, what your water management program has been saying, and what your, you know, previous testing events might indicate as well. With regards to, you know, a building level shutdown, that can be tricky because, as we've talked previously, stagnant water can be water that is ripe for Legionella growth. And so a building shutting down could actually create a scenario where that stagnant water actually makes the problem worse. So the response to a particular Legionella sampling event just really is multifactorial, depends on a lot of different things. So I'll stop there and hand it over to the GSA folks.
Courtney, looks like you have your hand up, so I'll let you jump in first.
Yep. So just a couple things I wanted to mention. So as I mentioned before, we've worked on 19 different buildings. Only one of those facilities had a full building closure. We have learned a lot. That was our first building that we managed under our new procedures. We've updated our bottled water policy. So we have tools in place for the building managers to get bottled water immediately. Our practice will be to restrict access to that outlet that's impacted, to flush it, and then to retest. And then one of the things I wanted to make sure that everybody knew, unlike some types of water tests for Legionella take a little bit of time to grow and then be completed. So I wanted Brad to just hit on that for a minute. So as we're performing those retests, those don't happen on a day's notice. They take a little bit of time to get the results.
Yeah, absolutely, Courtney. And you know, if I misspeak at any time, Chris and Troy, please feel free to hop in. But The traditional method that we use at GSA for Legionella is a culture method. And so when that water sample is taken and it's sent off to the laboratory, it has to be grown essentially. And so that takes between 12 and 14 days for that to come back and for the lab to look at that under a microscope and determine, what kind of Legionella and how much has grown. And so unfortunately, it's not as quick of a process as it is for maybe a total coliform or a lead and copper, where you can get that back in a very timely fashion. And so when we do take these proactive samples, please be aware that it can be a few week delay before we even get the initial lab reports back. And then when we get a contractor's full report, it might be a few weeks after that. But we do have information in our scope of work that lets the contractor know if they get notified by the laboratory of there's any issues. They have to contact GSA within 24 hours to let us know, so we can take those proper corrective actions immediately, and we're not waiting on any report from a contractor or anything like that. The only other thing that came to mind when Chris was speaking is obviously, we're talking a lot about this as far as in a routine sampling aspect. If there are any confirmed cases, we would work with the public health department, and they might have some additional water restrictions or things like that when there are confirmed cases associated. But that might change the conversation a little bit.
All right, now thank you all for those answers. Brad and Courtney, I'll address this to you too, because the CDC is not responsible for GSA policy. Someone's asking sort of what is GSA's obligation or the process to notify tenants of health-related issues such as drinking water quality?
Yeah, absolutely. So in cases where there's a concern affecting occupants, including individuals residing in or visiting a federally owned or leased space under GSA's jurisdiction, custody, or control, we have a notification process that adheres to the PBS risk management notification policy. And so this process involves notifying affected occupants about a variety of different things: environmental, health, safety, fire protection risks, and including instances of water testing results as well that surpass regulatory thresholds or certain limits that are maybe not limits are the right word, but systems that are not well controlled for Legionella as well. And so this process is consistent for federal tenants, contractors, and the general public that come and visit our facilities. And it's designed around transparency and ensuring everyone's well-being in spaces that we oversee. It can look a little bit different depending on what category of group that's in there. A visitor might see a sign over an affected outlet or something because we don't know that they're coming in and visiting the space. So we put a sign up there to let them know what's going on. But somebody that works in the building, they would get a formal notification from that regional office saying, hey, these are what the test results said. These are the action steps that we're taking in the short term. And these are the long-term action steps that we're going to take. And we're committed to giving you more information as it's available.
Great, thank you, Brad. I have a couple of questions on the lead and the copper. And I had someone ask about what types of corrective actions are typically taken when there are high levels of heavy metals. And then someone else was asking about filters. Do filters effectively reduce heavy metal count in drinking water?
I can dive into that. I don't want to get too deep into lead and copper control because it's a whole other big topic with a lot of other answers and considerations. But let me take the filters question for example. Filters work. For example, I worked for a while in Flint, Michigan during their lead crisis. We used point of use filters there, bone char carbon mostly, and did an extensive process and study to determine their effectiveness in removing that lead. And they were effective as long as they're maintained and the filters are changed as regular. The problem with point of use filters like that is often they're not changed as frequently as needed and such. And then also at the household level, those are pretty pretty easy to use, but of course you're depending on an occupant to do that. But in a building, yes, there's methods for that. As far as control, in a building, you have to say, well, what can I do in the building itself? Start with removing all the lead fixtures and brass, anything that you can get out of there, you need to do it. Then start by look at controlling temperature. Reduce the temperature in areas that's going to require lead. You can, if you have the ability to adjust for chemicals, you can add compounds such as orthophosphate to coat the pipes, and also control for acidity and hardness and alkalinity. Those are kind of the basics.
All right, great, thank you. I think this is a good question for Chris, because I heard you use the phrase well-controlled in one of your previous responses, and we have a question. Can you clarify what well-controlled, poorly controlled, and uncontrolled mean regarding Legionella? And does well-control mean that there's zero Legionella?
That's a good question. So this is relatively recent language. This language really comes out of an update to one of the ASHRAE guidance documents that was put out on around 2020. So a few years ago now, but relatively recently in the world of guidelines and reference documents from organizations like this. And what it's really referring to is kind of this routine testing. So this is not the kind of phrasing that would be used if there were cases associated with a particular building or device. But in the context of routine cases, routine testing, there are a number of different factors that you can put together to paint a picture of the level of control you have for Legionella growth in a particular building water system. We have a kind of user-friendly figure that we put together that's part of one of the toolkits that Dr. Ritter mentioned in our Legionella control toolkit that's up on our website. It's based on the ASHRAE guideline 12 document. And really what it does is talk about a variety of factors, including the amount of Legionella you might find, the frequency at which you find it in a particular testing event, the trend over time. So is it going up? Is it going down? The type of Legionella. So are you finding Legionella pneumophila, which we know causes most of the disease in humans, or are you finding some of the other species that might be, less risky overall? And kind of putting all those things together, it paints a picture of the level of control you have over growth. The question around, can a building that is ostensibly well controlled for Legionella growth still detect Legionella? And per the guidance from ASHRAE, the answer is yes. There are scenarios where very low levels at very low frequencies can be identified and have that building still be considered well controlled. And the thing to think about that risk is, this is helping you make sure that water is being well maintained in a building. That is really what this procedure and what routine testing is meant to accomplish. So finding Legionella in a building might not in and of itself be a cause for concern, but it can be a point of data to help you determine whether or not your water management program needs to be reviewed, whether some flushing needs to occur, whether some change to your procedure needs to be implemented. The verification and validation information provided by routine testing is, one data point that really helps you determine the level of control both you have of Legionella in your building, and downstream of that, the potential level of risk to occupants.
All right, great, thank you. We're near the end of, I think, of questions that we can comfortably answer on the spot. I see some really good questions coming into the Q&A, and I want to continue to encourage folks who are in the audience here to keep asking those questions. And like I said, if they're applicable to GSA policy, our subject matter experts will review them and provide formal written response. If they are more geared toward our colleagues at the CDC, we will certainly share that information with them. But what I'd like to do as we get back close to the top of the hour here, Brad and Courtney, I'd like to invite you, if there are any questions that I didn't ask, if there's any topics that you feel need to be covered, or anything that you want to impart on the customers who are with us today before we wrap up, I think now would be a good time to do that. So I kind of open the floor over to the both of you.
Brad, do you have anything you want to hit?
I'll let you go first.
All right. First of all, I want to thank our friends from CDC coming over and help support. I appreciate every step of the way. CDC helping, providing constant feedback. They've been there in support of our discussions all the way back since the middle of last year. So appreciate that. I appreciate you guys coming, listening to this for almost 2 hours. I appreciate your time. I ask that you go back and help others understand that while this isn't required, we're taking this proactive step because we want to make sure our buildings are at a level higher standard than anybody else in the country. I hope through the beginning of this presentation where Brad and I discussed our approach, we conveyed how all the types of things that CDC spoke about are going to be identified through our baseline testing, and on those facilities that meet the focus building criteria of ASHRAE are going to be focused on long-term from a water management plan. We very much are going to take the information we get from this seriously. In facilities where we find an issue with water quality, we're going to immediately block access to that outlet. We're going to start flushing and managing that outlet. We're going to determine what needs to be retested in those spaces. We have an additional IH support coming on, as well as a contractor that's going to help us focus on managing each one of these cases and providing additional support to the regions as we manage our program. I also want to make sure you know that the information we get from the baseline testing overall will be digested, shared with all those other federal, state, and local partners we have, and taken into consideration as we consider our long-term water management approach. We are going to do our best to come up with the best communication tools. We're going to continue, as Courtney Hatchell mentioned, to keep that website updated. Please reach out if you need help, clarification, answers to questions. Brad and I and Court have been working all these water management issues since last July. We have a team that has ran into just about every situation I think we could imagine running into. So we're here to help and provide support and provide the information on what we're doing. But I want you guys to know that we have a good plan in place, a very proactive approach. And when we get this completed, you can rest assured that our buildings are held to a standard, a level above those of any other buildings you're going to be visiting.
And I'll just add, I think it's essential to recognize the exceptional expertise of the health, safety, and medical professionals that we have within the various agencies that are represented on the call today. You know, there is a large emotional component of everything that we're doing, especially the baseline testing and when issues are identified. And really their expertise and dedication to water management practices is truly commendable. And they'll play a pivotal role in addressing concerns with professionalism and clarity, often easing those initial apprehensions by, you know, maybe some of your employees, things of that sort. So please do, you know, use and reference those subject matter experts in your agency when things do come up. They're a really valuable resource. And I just want to give a big thank you and shout out to all those individuals that attended today and that have been reaching out to us independently. We've had a lot of one-on-one conversations with individual agencies, and it's just been a great proactive, you know, really collaborative effort that, you know, I've met a lot of truly great people through this effort.
All right. Well, thank you very much. Thank you, Chris and Troy. Thank you, Courtney, and Brad. I just want to reiterate a couple of next steps that we went over. First, I can't say it enough, www.gsa.gov/water Water Quality is the website. Our national customer leads will be providing additional information to their points of contact in your agency's national headquarters. This will happen sometime next week, and that will include not extra, but additional information about testing and schedule, which many of you heard here today and is also reflected on the website. And also that list of buildings that your agency has an occupancy that are within the scope of this testing and sampling that we talked about. Those 1,400 and 6,000-ish federally owned facilities and leases. But again, that information is always going to be available, the general information on testing, scheduling, and our water quality management guidance and program on that website, www.gsa.gov/water quality. One more time, thank you to all of our presenters today for an engaging presentation lasting nearly the full 2 hours. Thank you to all of the attendees, all of our customers who came today, somewhere between 500 and 600 strong. So we thank you, and I see the questions coming in. Thank you very much for those. We will, as I said, export those, review them with our subject matter experts, turn them around into a formal FAQ document that will go out to you as part of the post-session package via email when it is ready. We'll also post that to our website, the Water Quality website, and the Client Enrichment Series website, which I'd like to draw your attention to the information on the slide in front of you. We have 2 great additional CES sessions coming up in the near future. We have next Thursday, that is the 22nd, RWA Policy and Process Fundamentals. And then we have coming up in March, Green Leasing Requirements. You can learn more about each of those presentations and register online at www.gsa.gov/CES, and you will also see at the bottom of the slide a link to that YouTube channel that I mentioned earlier. Do not do what I'm doing now and attempt to click on your monitor, because that is not a live link, but it will be in the slides when you get that in your email. We have about 4 dozen past Client Enrichment Series presentations on all manner of topics that we cover here. And we will be adding this one to that list as soon as it is available. So with that, I'd like to formally conclude today's presentation. Thank you again to our speakers, our friends at the CDC, my colleagues in the CES team, and all of our attendees today. And I would like to remind everybody that the goal of the Client Enrichment Series is to engage our audience on workplace topics that contribute to your mission success and to your effective management of your real estate and workplace programs. Once again, from all of us here at GSA Public Building Service, thank you very much and have a great rest of your day.